So it is on the local antibiotic therapy to reduce infection after operative treatment of fractures at high risk of infection. Okay. Now, when you look at this title, it is a very vague title. Okay, because they have not described what are the fractures at high risk of infection and who are they doing this for. Okay, but when you study this in detail, they'll give us the PICOT. Okay, so the first PICOT P is population. The study population consists of patient aged 18 to 80 years with tibial plateau or pylon fractures. This is your population. And they have further added that these patients who are between 18 to 80 years with either the plateau or pylon fractures should be having an operative treatment that are definitively treated with plate and screws. So conservative is an exclusion criteria. Okay. Then they define what are these high risk of infections. What are these high risk of infections? So these high risk fractures are, number one, those who are treated in a delayed fashion. That means type 4, 5 or 6 Schatzkers where the soft tissue damage is bad and you put them either on an X-fix or you delay the definitive treatment for more than 3 days so that the swelling subsides. Or this is for closed injuries. If it's an open injury, they described it as type 1, 2 and type 3A. And the last one is any pylon or plateau fracture which is associated with a compartment syndrome of the same leg. Okay, so these are your high risk. So they have described everything that you are supposed to know when you are trying to recruit patients for this study. Okay, then they describe what the intervention is going to be. Okay, so your intervention here is going to be place 1000 mg of sterile vancomycin powder directly in the wound and over all the metal implants at the time of wound closure. So you are going to put 1000 mg of plain vancomycin powder over the wound and over the metal implants at the time of wound closure. Then you have the control group. Where is the control group? Yes. So the control group is going to be participants in the control group require standard of care. They are not to receive local vancomycin or any other antibiotic powder. So there is no placebo here. There is no other powder to be used, no local vancomycin to be used during the time of wound closure. So that is your control group. Then you have the outcome. The main outcome is the presence of a deep SSI. Wow. Deep SSI in first 6 months after surgery. Okay. Now, they have told deep SSI, but how do they want to describe how is it an SSI? Okay, so for that, they have used the CDC guidelines. That is current guidelines define deep infections after fracture fixation as those occurring within 90 days. Okay, so this is your current guidelines of who is a deep SSI. And what did they use to establish this? They used wound characteristics as being evaluated using the asepsis method. Asepsis is for additional treatment, serous discharge, erythema, purulent discharge, separation of deep tissues, isolation of bacteria, and duration of patient stay. So this is a scoring criteria, and this was helping the clinicians tell whether this is going to be a deep SSI or not. Apart from that, even the surgeons thinking that this is a infection also mattered. Okay, so this is the primary outcome. Of course, there is some secondary outcome also for this study. So this is not important. So even secondary outcome, pertains to bacterial speciation and sensitivity. So if they underwent an SSI, they want to see which bacteria are growing and whether they are sensitive to vancomycin and other antibiotics. Okay, but always the primary outcome is more important than the secondary outcome. The primary outcome determines your sample size, it determines your entire PICOT. Okay, not your secondary outcomes. Now coming to the last thing, which is T. How do you enter exit this? Yeah. So this is T. So using final definitive fixation as the date of, as a zero date, you are going to check these patients at 2 weeks, 3 months, and 6 months after fixation. So these are your 3 time points: 2 weeks, 3 months, and 6 months. At each of these visits, you are going to do a clinical evaluation by the treating surgeon and interviewed by the research coordinator. So one is going to be a clinical assessment, and at 6 months, patient reported outcome measures such as VR12, short musculoskeletal function assessment, and patients return to usual activities. All of these will be checked. And if there is infection, then blood sampling is also done for these patients. So this is your PICOT of this particular study. So since the PICOT is very well established in the study, about 3 years they ran the study and they gave us the outcomes. Okay, so this is the same study. They had 2586 patients assessed for eligibility. Okay, so out of which 1550 were excluded because they did not meet the inclusion criteria. They might be 3B injuries, 3C injuries. They might be treated very early. They might be type 1 Schatzker, which did not require waiting. So they might be having many other things. Okay, so out of 2586 patients who had a plafond or pylon fracture, 1550 were excluded. Out of the remaining 1036, they randomized into 2 groups, whether they got vancomycin or not. Okay, then out of these, they realized that there was some crossovers. Okay, but remember, the crossovers, even though the people who required vancomycin did not get it, or patients who did not were in the arm which did not require vancomycin, you still gave it, they will still be calculated in the same trial to which they started off with. Okay, because some trials are based on the intention to treat. So if the patient was supposed to be in the vancomycin group, even if he did not get it, he will be still in the vancomycin group itself.